Hi, my name is Sally Liao, the journalist from Amon Today. Today, I have the privilege of speaking with Dr. Kibos, the founder of Kibos International Health Foundation. It's a charitable organization based in Canada. Welcome, Dr. Kibos.
Thank you, Sally, for your invitation.
So, when did you come up with this idea of creating this organization?
Sally, upon my return to Kenya in 2020, after for more than 2 decades of being away, I encountered a sobering reality in the community of my birth. I was deeply disheartened to discover that numerous peers, friends, and colleagues from my age groups had succumbed to treatable medical conditions like myocardial infarction, diabetes, and AIDS, especially. The, the experience left me with a profound sense of loneliness, grappling with the void created by loss of individuals whose lives would have been saved with access to adequate health care. The idea for Kibos Foundation originated in 2020 with a dedicated clinical and scientific advisory board with the additional 7 members, as you can see, Sally, on our website.
Okay, so what was the goal of your organization?
Sally, our primary objective is to address the healthcare challenges in rural Kenya, focusing on the pivotal aspect of accessibility and affordability, particularly for the less privileged in society. Having grown up in rural Kenya, I understand well the conditions, the hardships faced by the residents in those areas. While the government is making efforts, there are still gaps that require support, well wishers, to ensure that everyone has access to the healthcare they rightly deserve.
Sure. So, what is your plan in order to fulfill this noble calling in rural Kenya?
By the grace of God, Sally, first of all, we need to find an infrastructure that can make accessibility to remote parts of Kenya a reality. This can only be made possible by having a mobile clinic with the ability to access those areas. Secondly, so far we have used voluntary doctor missions in carrying out our activities, and therefore we are calling upon others of the like-minded to join us in this effort of making healthcare a reality in rural Kenya. Although this does not give a lasting solution, Sally, but it is better than nothing, at least for now. Thirdly, we are going to come up with a training facility for doctors interested in rural outreach and other specialties in order to have a lasting solution to the problems. However, there is prevalence of cardiovascular diseases which our mission necessitates a cardiovascular center complete with more local doctors who will carry out prevention and treatment. This center will contain a cardiovascular laboratory for training, data collection for research purposes.
Of course, Dr. Kibos, you being a specialist in cardiology, you will make this very professional. So, do you have any partnerships locally and abroad?
Sadly, yes, we do. In collaboration with the Ministry of Health and central government, we have forged impactful partnerships with the county government in Kenya. Recently, our team of experienced specialists from all over the world visited rural Kenya to provide voluntary medical services, contributing to the enhancement of healthcare accessibility in underserved areas. Additionally, we are actively benchmarking against the well-developed Canadian healthcare system. This strategic initiative serves as a source of guidance and reference, informing our approach for future intervention in Kenya. By drawing insights from the Canadian model, we aim to implement sustainable and effective healthcare solutions that align with global best practices.
Wow, that's a very good starting point.
Yeah.
Has the foundation so far carried out any projects in Kenya?
Yes, Sally, we have done. We have already piloted 10 mobile missions in rural areas, not only to strengthen healthcare infrastructure in the schools system, but to do real humanitarian work in the entire community. Yes, I will highlight a few of the projects that we successfully carried out in Kenya. One of the projects we did in 2021 at the heart of the COVID-19 pandemic, where our team took part in sensitization of the public in Ndiwa sub-county, Homa Bay County. The team, consisting of doctors, distributed face masks, medical drugs, sensitizers, and flyers containing information on the prevention to schools and to the general public. Another project was in August 2021, done in Kajiado West Sub-County, in Kajiado, in Kenya, in Tania Integrated Center for Homeless Children and Ole Polo's primary schools. The foundation donated reusable face masks, medical drugs, foodstuffs, sensitizers, soaps, and our doctors offered education on ways to prevent COVID-19. The third project was carried out in Kajiado County, where the foundation distributed foodstuffs for a school feeding program. Though this was not our main intention, but because children had kept off school due to hunger and malnutrition, by doing so, the turn of schools in these areas improved. The fourth project was in October 2022, where we carried out a project dubbed Menstrual Health for schools going girls. The foundation distributed sanitary towels to over 800 girls in 4 primary schools to help in their personal hygiene. Lastly, Sally, we had the last project recently when I led a team of specialists to Kisii and Trans Nzoia counties, where we offered our voluntary services in various hospitals within those regions. Together with the county governor, we discussed and agreed on areas of partnership with a view of making healthcare accessible to all.
So, Dr. Kibos, what are the challenges in your endeavor?
Sally, as I had mentioned earlier, the infrastructure is lacking, and at the moment, we need mobile clinic for easy accessibility to the remote areas of the rural Kenya. We are also faced with huge financial challenges because we need to come up with a cardiovascular and training center in Kenya, because operating with voluntary doctor missions is unsustainable. We cannot offer a long-term solution. But for the moment, it's better than nothing. By the grace of God, we are therefore appealing to individuals, organizations, churches, and other well-wishers to support us in this journey so that we can help the less fortunate who can't access affordable health care. We cannot do this alone. We need each one of you to visit our website and click on donate. Donate $1, $2, $5 to support our mission. I appeal to you all. We are delighted to announce the successful establishment of memorandum of understanding with the many counties and universities in Kenya, encompassing 3/4 of the Kenyan population, for collaboration in research endeavors. See our website. I welcome you to see our website. This significant milestone underscores our commitment to advancing and enhancing impact of research that addresses the healthcare needs of a substantial portion of the population. This is important for our international partners. As we embark on this ambitious initiative, we extend our earnest appeal for partners to join hands with us in transforming these MOUs in tangible, impactful realities. We believe that collective efforts and diverse expertise will play a pivotal role in realizing the full potential of our research endeavors, fostering positive change and progress in healthcare for the benefit of communities across those counties. Together, we can make lasting impact on the healthcare and well-being of our significant segment of the population, not only in Kenya, but East Africa in general.
Wow. Dr. Kibos, this is a very noble calling. I wish you all the success for this endeavor.
By the grace of God, thank you, Sally.
Thank you very much.
Thank you.